On behalf of the Center for Science and Environment, I welcome everyone to this initiative on the occasion of the World Antimicrobial Awareness Week 2020. CSA is a non-for-profit organization. It's a research and advocacy organization based out of New Delhi, India. I am Rajeshwari Sinha from the Food Safety and Toxins team here at CSE, where we work on the issues of antimicrobial resistance, uh, a global public health threat today, particularly in the areas of the animal and environmental aspects. This conversation that we are going to have today is a part of CSE's Act on AMR series as part of the World Antimicrobial Awareness Week, wherein we are engaging with different experts around the world to know their thoughts on how they would like to address the issue of antimicrobial resistance, in particular antibiotic resistance, and what are they doing at their own levels. And today we are going to talk on a very interesting topic, which is drug take back. And more specifically, so we are going to see the drug take back initiative from South Africa and understand the linkages and how it is able to help address the issue of AMR. And to tell us more about this, to talk to us today, we have with us Ms. Jackie Miamin. Jackie, welcome.
Hi there, and thank you very much for having me on this exciting interview.
Yeah, I'll briefly introduce Jackie to all of you. Jackie graduated from the Rhodes University with a B.Pharm distinction and completed her internship at the Weinberg Pharmacy in Cape Town. She has been an active community pharmacist for the last 35 years and also served on various committees of the Pharmaceutical Society of South Africa and was a founding member of the Independent Community Pharmacy Association, ICPA, where she's also working as the CEO. Currently, Jackie is serving her second term as an elected member of the South African Pharmacy Council, SAPC it is known as, where she is the chairperson of the practice committee, and she's also the chairman of the Cape Western Province branch of the Pharmaceutical Society of South Africa. Jackie strongly believes that community pharmacy is ideally positioned to positively contribute to the health and well-being of people within their local areas and will be a critical primary care provider. So once again, thank you very much, Jackie, for joining us and agreeing to do this with us. We are really pleased to have you on board. We have a couple of areas to discuss. We'll touch upon them and hear from you about the initiatives in South Africa. So very quickly for our viewers, if you could tell us what is a drug take back initiative and how it is linked, what is its importance in the context of antimicrobial resistance issue?
Okay, thank you. So a drug take back initiative is a drive that aims to provide a safe, convenient and responsible means of disposing of prescription medicines and drugs, whilst also educating the general public about the potential for abuse of medications and, of course, antimicrobial resistance. Its importance with reference to antimicrobial resistance is that this initiative ensures that patients are not sitting at home with leftover antibiotics. You know, a lot of people unfortunately do not finish their course of antibiotics. So they have some antibiotics sitting in their cupboard at home. And then when a member of the family or a friend gets something that they think was the same as what they had, they share their antibiotics. And of course, this is a big no-no. This, the correct antibiotic can only really be ascertained by a general practitioner, a doctor or a pharmacist. And this sharing of antibiotics causes resistance because often it's not required and it's not the correct antibiotic and the correct dose. The other thing is that, people tend to then throw away leftover medicines into their rubbish, or they flush it down the toilet. And then, of course, they leach into our groundwater, they get into our sewage systems, and then we have all the associated risks of having antibiotics in our water and the development of the so-called superbugs. I think the whole initiative as well reduces the antibiotics getting into landfill sites where they can be retrieved and consumed by people or animals. And it's the same risk. where, bacteria are now encountering antibiotics in suboptimum doses, which leads to this resistance.
Right. Very nicely explained, Jackie. Uh, Thank you for that. What I would like to know next is, how are you as the ICPA involved in the drug take back initiative in South Africa, and what are you doing? How do you execute it?
Okay, so the ICPA is a nonprofit company. We represent 1,200 community pharmacies across South Africa. And I think one of the things that we do is we try and uphold any efforts by our country when it comes to drug take-back initiatives and antimicrobial stewardship. So South Africa has really taken a multi-pronged approach to the challenge of these leftover medicines. Firstly, we've got very strict guidelines for the managing of wastewater. We have tight regulations on the use and disposal of medicines, including antibiotics, in human and veterinary medicine, which includes intensive education on the misuse of antibiotics. And this is at prescriber level and to the public. We have the National Environmental Waste Management Act, which outlines the fact that medicines may not be disposed of into landfill or into our water systems. Following that up, our statutory council, SAPC, put in place a minimum standard which talks about the safe and responsible disposal of medicines. Every single producer of pharmaceutical waste has to register on a central database. And on that central database, we then need to hook up with a registered waste disposal company. When we've got medicines that have expired, been returned, damaged, or for whatever reason, medicines for disposal, we have to record them. We have to get them collected by the waste disposal company, who then destroy them and make sure that they are absolutely non-retrievable. And they give us a certificate of destruction. That certificate we have to keep for 5 years. So the framework for the drug take-back initiative is in place. And as I've said, it is illegal for a pharmacy to dispose of medicines unless it's through this particular way. The other thing that's in place is that pharmacies are obliged to take medicines back from patients who they've dispensed for. And so if you've got leftover medicines, you can bring them back to the pharmacy and we must take them back.
Right. So I understand it's from both the consumer angle as well as from the pharmacist angle. Both can address their, leftover or expired medicines through this initiative.
Absolutely. And
Right.
what I could say as well from ICPA as to how else we're involved, one of the things that two of the things we do, we have an annual campaign. We call it the Brown Bag Campaign, where we encourage members of the public to bring their medicines into the pharmacy. So pop them in a bag, bring your first aid kit, bring all your medicines into the pharmacy. The pharmacist will then sit with them and say, because very often somebody will have medicine at home, they've forgotten what it was for. And so we'll say to them, this is what this medicine's for. Yes, you can keep it, and this is what you use it for. We even will write things on the label for the patient. Some of the medicines, like for instance, antibiotics, we'll say to them, this is not a complete course of antibiotics. You shouldn't keep these. Let us dispose of them for you. So that is a campaign we have every year. It also makes sure that people's first aid kits don't have expired medicines in them. The other thing ICPA has done is we've signed something called the Global Respiratory Infection Partnership, the GRIP Declaration. Now, what this recognizes is the imminent onset of a post-antibiotic era, which is really scary, and also the declining numbers of new antibiotics. In this declaration, we commit to consistent, sustainable, evidence-based advocacy and intervention for rational antibiotic usage and stewardship. We are part of this formulation of a framework for non-antibiotic treatment options for respiratory tract infections. You know how often people want antibiotics for colds and flu, which are viral. The other thing we're involved with is a multi-stakeholder commitment to antibiotic stewardship and rational antibiotic use.
Right. Okay, which means it's a lot of things that South Africa is doing. If I could just add on to what there is, my experiences from India, uh, there's a small initiative that's also happening down south in the country. The state of Kerala has developed a program. It's called Proud, the program on removal of unused drugs. It's a state level initiative taken up in collaboration with the state drugs control department and the Kerala chemists and druggist association. So the government and the private sector has come together to do this initiative where they have placed bins across medical shops in one district. About I think it's been a year or so that it has been launched formally, and the process of household leftover medicines or expired medicines, any such kind of things, the consumer can come and drop off to the medical shop, which is again after a certain period of time collected, sorted, and then disposed. So we have a similar program in one of the states, and also it's being considered on a larger scale to be taken up on a larger scale. But while I would like to congratulate you for the multiple ways in which you are approaching this, I think there's a lot that countries can learn from each other. Uh, Taking this discussion forward, Jackie, I wanted to understand. Um, what do you have to say about producers or manufacturers being responsible for doing this kind of a work? Because yours is a pharmacy. Pharmacy is coming together and doing it. For here, the what I just mentioned is partly government and partly chemist and druggist bodies. What do you have to say about the manufacturers being responsible for it? And this brings me to the concept of extended producer responsibility. If you could briefly tell us.
Absolutely. And that's a wonderful initiative you've got there in India. And I agree, we can learn from each other and really get to grips with this challenge of medicines, unused medicines. So the greatest challenge that we've got is that currently the burden of the cost of destruction of this unused or expired medicines lies with the community or hospital pharmacy. So we're the end of the supply chain. We're the last supplier before the medicine goes to the patient. And all of that cost is currently sitting with us. Now, it is our belief that other supply chain participants should be involved, and in particular, the manufacturers should shoulder part of this incredibly important responsibility. I believe if more funds were available for drug take-back initiatives, the whole drive would be far more successful. As good as our intentions are, unfortunately, medicines are dumped. It is a financial burden for pharmacy. It's also sometimes inconvenient for patients, who are trying to take medicines back to the pharmacy that dispensed it for them. And, people use more than one pharmacy very often, and pharmacists are reluctant to take back medicines dispensed by somebody else because it's going to cost them money. And so as good as the intention of our drug take-back initiative is, it does unfortunately have failings. And I absolutely believe that the manufacturers should be part of the solution.
Right. Two quick things. One, which you mentioned, is the challenge or the burden of destruction. So I understand that these kind of medicines which are expired and unused often require destruction by high temperature incineration, which is not the normal way of just burning it. So it requires a lot of investment in even procuring the apparatus for high temperature incineration, and then there is a operational cost and maintenance cost. And when you I agree when you say that the role of manufacturer is important, and perhaps that is the concept of extended producer responsibility, where uh, the producer takes responsibility of the product till the end of its life cycle. It's the cradle to grave approach, and it's not just for drugs. It's there for many other products like electronics, batteries, and plastics, packaging. It's there. Uh, Globally, we have seen, apart from India and South Africa, when we were doing a little bit of research, we know that in Europe, many of the European countries have, long-standing drug take-back initiatives under this overarching realm of EPR, where the manufacturers are funding it. So and it's again backed by law. The European Parliament has passed a directive which said that it is important to dispose expired unused drugs properly, and through setting up of proper disposal systems. So what do you have to say about the importance of policies around it, about the need for an EPR law, or maybe which puts in place on the policy or the regulatory side this concept?
Okay, no, absolutely. So, as you've mentioned, the extended producer responsibility means that the producer or the manufacturer must take measures in managing their products. And as you said, from cradle to grave. Now, the cost of responsible disposal should be built into the cost of manufacturing the drug. This means pharmacists at community or hospital level can be remunerated for providing the important service of taking medicines back. And as you've already said, in many countries, this already applies to batteries. In South Africa, it applies to oil. So if you've changed oil in your car, you mustn't dump your oil. You take your oil back to anybody who sells oil. They will take it back. And we know that ultimately it's the oil companies that will fund taking that oil back, refining it, and making sure that it doesn't end up in the environment. And we need to have the same for medicines. I think as well, what it does is that if somebody is being remunerated or it's not costing them anything to provide a service, it encourages compliance with the laws. This in the long term will protect our people, and it will protect our environment, and it will assist in the fight of keeping our antibiotics effective by reducing resistance. And I believe policy is the only way to ensure fair, responsible drug take-back initiatives and to ensure that this does happen.
Right. And I also will add to that first, the need for a conceptualized framework around how you want to bring about this drug take back process. This accompanied by the necessary EPR specific laws or guidelines, which will both of them go hand in hand in order to, and then the next step is the implementation of execution of this process. So, Jackie, if I may ask you, what have been some of the key positive learnings that you have gained in this initiative, and the challenges I know you've mentioned, but if I have to say that, what is the message that you have for other countries from the developing part of the world that can learn from running initiative from you? What is it that you would like to add?
Okay, so firstly, I'd like to just say we've identified through the number of campaigns we've had that there is a real need for this initiative. I think, the average citizen in South Africa, and I'm sure globally, wants to be responsible about medicines, is aware of superbugs, and wants to protect our antibiotics. So what we found is that the public really welcome the opportunity to bring their medicines back into the pharmacy. So, when we invite them to bring the medicines in, we have queues of people coming in. It's a wonderful opportunity for the pharmacist to really cement that relationship between healthcare provider and patient, and to advise them on the safe use and disposal of their medicines. The campaign has really been well supported, and we would like to be able to offer more of these more often, and in fact to have it every day of the year, that anybody can walk in at any time with their medicines. Now, because of the cost of disposal, pharmacists, when presented with medicines not dispensed by themselves, will very often say to the patient, look, we're really glad you're bringing these medicines in, but we didn't dispense them. It's the pharmacy down the road. Won't you please take it back to that pharmacy? Now, immediately you're putting a barrier up, because you've now had the opportunity, this patient has bought the medicines in, you've had the opportunity to take them back and dispose of them. And now you've said to the person, no, you must take these back there and these must go back there. And you're now making it inconvenient. And what happens then is the medicines tend to be dumped, or they put back into the house where they could be reused by somebody who doesn't know what they're for. So although it is legal to turn medicines away, it is a barrier, and we really would like to get away from this barrier. What I would like to say for other countries is that all countries, really, we should stand together and insist on this extended producer responsibility. As I say, we see it in the oil industry, we see it with batteries, and it works really, really well. All we need is for a drug company to factor in a few cents per unit of medicine that they produce. And one of the things that we'd like companies to do as well is to reduce the amount of outer packaging. You know, as a pharmacist, we get these fancy boxes, these huge bottles, and we mix them up, and the box and everything just goes into the dustbin. And so we'd really like to say to manufacturers, reduce the amount of packaging and rather invest that money in an extended producer responsibility program. I would say as well that the pharmaceutical manufacturers need to have environmentally sound returns policies. They need to provide consumer education on medicine disposal, and they really should contribute to a central fund. And as I say, if it's a few cents per unit produced, it would be fair for everybody. Because, you know, we also don't want manufacturers to say this one is giving more than that one. So if we base it on the amount that they're producing, it's fair and it's transparent. And then what I would say as well is that ICPA at the moment here in South Africa, we are in the process of developing a sector plan for submission to our minister, where we are advocating for policy to be put in place. And I really would like to join hands with India, with all the other countries in Africa, that we all do the same. There are really only a few manufacturers in the world. And if every country stands up and insists on it, we can make it a global policy. And what a win that would be.
Right. Thank you, Jackie, for this strong message that you sent across. This awareness week. I think first and foremost, what I captured from this conversation is the importance of awareness, and what more than having a platform like this to create awareness on drug take back and the AMR linkages. So thank you for that. If I may summarize what we discussed today, one is that this concept of drug take back, of course it has tremendous relevance in the context of AMR, but for long standing programs, these were earlier, they came up because of preventing pollution, environmental pollution, preventing their misuse and overuse because of storage at homes, preventing secondary trade, but of late their relevance in the AMR context is becoming more and more important. And like you said, countries must stand together and urge for this. And now that there are global intergovernmental agencies who have started talking about its importance. Second is that, yes, manufacturers do have a role and responsibility to take care of the product till its life cycle has ended. European countries are forming producer responsibility organizations where manufacturers are doing this, coming together, not only to fund it, but also to see it at the operational levels. So we have so many examples in front of us, Hungary, Sweden, there is Canada, there is a lot of the European countries who are doing it, France. I don't think there should be lack of examples or learnings from these countries. And one thing I want to touch upon before closing this is the importance of municipal laws as well. In India, there are municipal laws which talk about the need to, collection of drug waste separately. So that is something we should not leave away and talk about EPR only. The importance of having the right municipal laws can also help in this process. And this is again specific to different settings. Each country can look at what are its own ground context, ground realities, and develop their own EPR framework, design the necessary policies, and develop this as a very good tool for containing AMR. Last point is awareness. That's the most important, and I think all running programs, even yours, have a very strong component of awareness in order to motivate the consumers to come up and deposit expired and unused medicines. So thank you, Jackie. Thank you very much. I think we've had a very good chat today, and we really hope that stakeholders who are watching us, viewers who are looking at this, not only find an interesting area to dig up, to do more research, but they can reach out to you or us in order to know more about this. And yes, really, thank you on behalf of CSE. Thanks.
Thank you very much. I think this is a wonderful initiative that CSE is driving here as far as getting awareness out there.
Thanks.
Thank you.
Thank you.
Bye-bye.